Hello all. Today we're going to learn about an Indian multinational pharmaceutical and biotechnology company, Cipla. Most of us at least once must have heard the name of the company, Cipla. Let us know this company in a much better way. Cipla Global Limited is an Indian multinational pharmaceutical and biotechnological company headquartered in Mumbai, India, Belgium and Surrey in the European Union, and Miami, Florida in the United States, with manufacturing facilities in Goa 8, Bengaluru 1, Baddi 1, Indore 1, Kurkumbh 1, Patalganga 1 and Sikkim 1, along with field stations in Delhi, Pune and Hyderabad. Cipla primarily develops therapeutics to treat cardiovascular disease, arthritis, diabetes, weight control and depression, other medical conditions. As of 17 September 2014, its market capitalization was INR 517 billion, which is 8.4 billion US dollars, making it India's 42nd largest publicly traded company by market value. It was founded by Dr. Khwaja Abdul Ahmed as the Chemical, Industrial and Pharmaceutical Laboratories in 1935 in Mumbai. The name of the company was changed to Cipla Limited with effect from 28 July 1984, wherein the word Cipla came from the first letters of each word in the chemical old name, the Chemical, Industrial and Pharmaceutical Laboratories. In the year 1985, US FDA approved the company's bulk drug manufacturing facilities. In 1994, Cipla launched Deferiprone, the world's first oral iron chelator. In 2001, Cipla offered medicines antiretrovirals for HIV treatment at a fractional cost, less than $350 per year per patient. In 2012, the company slashed prices of 3 life-saving cancer drugs by 50 to 64%. In 2013, it increased its stake in its South African joint venture Cipla MedPro from 50% to 100% stake for INR 27 billion, which is 440 million US dollars, to strengthen its position in the African continent. Cipla MedPro is the third largest South African pharmaceutical company and it was founded in 1993. Cipla has 34 manufacturing units in 8 locations across India and has presence in 170 countries. Exports accounted for 48% INR 49.48 billion, which is 800 million US dollars of its revenue for FY 2013-14. Cipla spent INR 517 crores, 5.4% of revenue in fiscal year 2013-14 on R&D activities. The primary focus areas for R&D were development of new formulations, drug delivery systems and APIs, active pharmaceutical ingredients. Cipla also cooperates with other enterprises in areas such as consulting, commissioning, engineering, product appraisal, quality control, know-how transfer, support and plant supply. Cipla manufactures a range of pharmaceutical and personal care products. The company offers active pharmaceutical ingredients, APIs, and formulations in therapeutic areas such as allergy, analgesic, anti-malarial, anti-infectives, cardiology, dermatology and cosmeceuticals, diabetology, gastroenterology, HIV/AIDS, hormones and steroids, iron chelators, musculoskeletal, neuropsychiatric, nutritional and ophthalmic products, oncology, respiratory, urology and women's health in various dosage forms. It also provides veterinary products for various animals including companion, equine, general care, livestock and poultry. In addition, the company offers inhaled medication and devices such as dry powder inhalers, single-dose capsule and multi-dose dry powder inhalers, breath-actuated metered dose inhalers, non-static spacers, baby and infant masks and nasal sprays. Further, it provides consulting, commissioning, plant engineering and technical know-how transfer and support services. Cipla has over 22,000 products in 65 therapeutic categories available in over 40 dosage forms. Its key products include the following drugs: escitalopram, antidepressant, lamivudine, fluticasone propionate. The equity shares of Cipla are listed on the Bombay Stock Exchange, where it is a constituent constituent of the BSE Sensex Index and the National Stock Exchange of India, where it is a constituent of the S&P CNX Nifty. Its global depository receipts (GDRs) are listed on the Luxembourg Stock Exchange. As on 30th September 2014, the promoter group Dr. Y.K. Ahmed and his family held around 36.80% equity shares in Cipla. Around 148,000 individual shareholders held approximately 18.67% of its shares. LIC is the largest non-promoter shareholder with approximately 6.45% shareholding in the company by the end of September 2013. As on 31st March 2013, the company had 22,036 employees, out of which 2,455 were women, that is 7.30%, and 23 were employees with disabilities, 0.1%. During the fiscal year 2013-14, the company incurred 12.85 billion rupees, $210 million on employee benefit expenses. Cipla established a hospice named Cipla Palliative Care and Training Center for terminally ill cancer patients in Pune in 1997. The patients in this hospice get all in medicines and services free of cost. The company, in its business responsibility report for the fiscal year 2013-14, informed that it had cared for over 8,500 patients in the last 16 years. In August 2007, Cipla launched Pregnancy Termination Pill, iPill. The morning after pill was sold as the easiest way to avoid unwanted pregnancies, but drew criticism as it was sold over the counter, hence not requiring a medical prescription, and for the probable side effects. The drug contained twice the amount of main ingredient levonorgestrel as compared to similar drugs such as Norvilo, Win Medicare, and EC2 from German remedies. Cipla is criticized by original drug manufacturers as they, generic pharma companies, sell the products developed by others without paying anything to the developers. On average, the cost of a generic drug is 80 to 85% lower than the brand name product. This leads to criticism of both the country's patent laws and the generic companies, as it denies the original manufacturers of the share of profits, a part of which they could have used for research and development of advanced medicines. So we got to know about the various aspects of Cipla. We went through the company's history, to its initiatives and criticism. Hope the information was useful, and have a good day ahead.